Personal budgets in social care are well established, and personal health budgets have also been widely tested. The ultimate aim is to integrate health and social care so that people have a single budget to cover all their needs. Kent County Council is a lead pilot site looking at how integrated budgets might work. In this film, we look at the work taking place in Kent and hear from those involved about what integration would mean for them.
NHS Eastern and Coastal Kent is one of 20 in-depth pilot sites nationally. So for the last 3 years we've been looking at how personal health budgets work within health. But what the Department of Health is really keen to explore is building upon personal health budgets and no longer just having personal health budgets and social care budgets, but actually how it would work to bring those together and have an integrated budget.
Peter is unable to walk and talks through a device.
Patience.
Peter is helping Kent move towards an integrated system that would make a big change to his life.
Peter has been supporting the personal health budget programme for the last 3 years. He uses both health and social care, and as I say, for him it's quite frustrating because he has a piece of equipment that he communicates with, and he clearly sees that as a social need because it's about him communicating.
How are you?
I'm good, thank you. We haven't seen each other for ages. Unfortunately, social services can't fund and maintain that piece of equipment, and he's been referred to health, and health are now looking into that, but it's taken a long time. Whereas what we hope in the future, if you've got integrated budgets, we would look at one budget being allocated to maintain that piece of equipment.
Peter is part of a steering group that also includes health and social care professionals. It brings people together to discuss how to implement an integrated budget.
As you know, I've been working on personal health budgets now for the last 3 years. There's been 20 in-depth pilot sites looking at how personal health budgets work across a wide range of condition groups. It's a small number of people, but what we're trying to do through the steering group, we have health and social care representatives on that, which consists of frontline staff, so nurses. We've also got social workers that sit around the table. We have CCG representatives and communication leads, and also we have budget holders both from health and social care who can share their experience around receiving budgets and their frustrations around how the system's not working.
In social service, direct payment it is more hard too. Say what care is in paper, that you say you can get help too, get you dressed, but in normal life in care you can call care brilliant things of like I need help in toilet when I am out, but I don't need that person to walk around with me every minute of my life.
So Peter's involved in the steering group because he has been through the system. He has both health and social care needs, and he knows what works and what doesn't work. So by having him come to that steering group is so important because he can help shape how we will deliver integrated budgets.
For Peter, integrating health and social care budgets would make his life easier.
And I think when NHS and social service do work together, we can get calling great Britain again.
We see the integration of personal health budgets and social care personal budgets as being an enabler towards integrated working. So I think there are probably two strands to this. Certainly from a patient or a service user perspective, it means that they're going to get their resource allocation in one place and can then use that money flexibly to access the services that are right for them. And then secondly, as an enabler for health and social care practitioners, it will encourage them to work together.
Health and social care staff already work together in some of Kent's integrated teams. Harris, who has Parkinson's, has benefited from health and social care professionals working more closely together. His health and social care needs were considered in one plan, covered by his personal health budget, funded by continuing healthcare. Harris talks regularly to support worker Katie Bell and community matron Claire Morgan.
It reduced the impact on him because he moved from social care into health. He just revised his plan. The funding stream was arranged behind the scenes. So he just continued to live his life and get the package of care that he needed, but he remained in control around how that was delivered.
So we've just come to review your support plan today.
All right.
Obviously we want to make sure that we can look at all of the different needs that you've got.
For Harris, having a single budget funded by continuing healthcare for both his health and social care needs has demonstrated how a system of integrated budgets could improve outcomes.
You've got Claire Morgan, who's his nurse, and the broker working together to look at how his needs can be met with his budget and improving the outcomes for him. But it means that he doesn't have so many people coming into his home. And he is really in control around the care and support that he accesses, which considers both his health and social care elements. And Harris has had a positive experience around having a personal health budget, kind of really an integrated budget, because it does address both his health and social care needs. But he's now keen to share his experience and support others through that process through something called peer support.
Maybe we can form a volunteer service where we could help the new user through the system, advise them.
So you could give them information on what's available to them, or what worked for you, perhaps.
That's right. Well, I personally think that social care as well as the health care should really merge together and share the information they have between themselves. It makes my life so much easier by just having one single assessment.
The goal of one individual carrying out a single integrated assessment could streamline the process for service users.
It's one contact, and then that contact can be dealt with the aim that the individual then receives input from the appropriate profession, has the right assessment undertaken at the right time, which should mean that they don't have as many people trampling through their front doors, and that they don't have to repeat the same information over and over again.
When they're doing a support plan and we're talking about their needs, they don't really know that some's funded by social care and some is funded by health, and they get caught up in the middle of the two organisations.
Vivian, who has MS, and her husband Mick are an example of two people who've experienced the frustrations of dealing with health and social care systems. Georgina is helping them to become the first people in Kent to receive an integrated budget.
They would like to go on to the integrated budget pilot and help us learn around how it will work, because they've experienced the frustrations around health and social care not working together. Vivian has a piece of equipment, a hoist, and they've had some issues recently about how who uses the hoist and how it's used. And in the end, they had to bring in health and social care and have a huge meeting and discussion about this piece of equipment. They didn't understand why they had to go to social care over one part and why they had to go to the NHS over another part. They knew that they needed the hoist and that they wanted to use it in a particular way, but felt that they had to go through a very bureaucratic process to overcome those issues. Through integrated budgets, you'll have one review and one audit. So you won't have a health professional coming in and doing their review and finance audit, and then a social care professional coming in and doing their
Reviews, definitely.
For Mick, as a carer, an integrated budget could be a step in the right direction for improving the experience of those accessing both health and social care.
I'd like to think that an integrated budget would help to bring not only the two departments together, but also a collective understanding of what the individual's needs are holistically for that whole care package.
Integration is not without its challenges in Kent, but they're committed to the journey.
We don't have systems that talk to each other, and that will be something that will take quite a considerable period of time to work through. So it is really looking at alternative ways that you can bring teams together.
Some of this is going to be around cultural barriers. We're bringing practitioners from two different separate sorts of organisations with different values and beliefs. So in order to get professionals working together in a better way, actually there's an awful lot of work that needs to be done to help them to work through what that means and ask them to work in a different way with each other.
Integration as a whole of these two departments has to be the kind of holy grail at the end of the day. So I think a greater level of integration, focusing in on this individual's care requirements, would be a real step forward, I think. It may require more than just the integration of the budget, but let's see. Let's start somewhere. That's the way to do it.